okay, that allows us to move and function well. When that gets injured, like we discussed before, that creates a dysfunctional anchor and creates tension. So right now, if I'm pulling on my shirt like this, and I have trouble moving on my shoulder, I would ask, do I have a shirt problem or a shoulder problem?
Okay.
I have a shirt problem. Okay. And most people would most clinicians would recognize that, but what they don't recognize, because it's so relatively unknown, this whole new concept, is that there's a deeper tension, and it's within the structure of the bones and fluid-filled organs. And matrix-repatterning therapy recognizes that, relieves it, and for the frustrated client, it can be the reason why they're having so much trouble getting real relief from their standard muscle work, physical therapy, chiropractic care, whatever it is, exercise, yoga, stretching.
Oh, okay.
Okay?
Yes. So when you go in, you have a shoulder problem, they want to, you know, maybe your rotator cuff, they'll want to do surgery on that, whereas this would be an alternative to come in and talk with you and see exactly if the matrix repatterning would benefit them.
That's right.
Yeah.
Yeah,
Okay.
or back pain or leg pain or knee pain or really all kinds of things. Neck pain from car accidents.
So it's anyone can come in with the matrix repatterning, because there's not a set person or set injury that would need your...
Yeah, that's right. Theoretically, it could be good for anybody. What I do when people call in, because it's a hard it's such a new concept that even when people call in and make an appointment, I call them back before they come in.
Okay.
And I talk to them about the history of impact injuries. I want to make sure they're a good candidate for this care.
Okay.
Now, actually, most people are, because who has never fallen hard on the sidewalk or out of a tree or off a swing or in a car, off a horse, car accident? So if those are there, we can reduce them. And the beauty of matrix repatterning therapy is it's permanent in nature. The majority of people that I see, it requires 6 to 10 visits to reduce this tension that's in different places in the body, and then we're done.
Oh.
And then I release them to go back to take care of themselves in other ways. So be it, again, stretching or yoga or chiropractic or muscle therapy. I am a chiropractor, but I leave time, I want the time in my schedule to be open for this.
Okay.
So if they do need more care, they get better result after this is done, because it's not fighting this tension that we talked about anymore, and they tend to need less care in the future and do well.
Oh.
Yeah.
So that seems to be minimal on the treatments, only 6 to 8 treatments.
Yeah, 6 to 10. Some people, when I get people with real complex injury patterns, people that have been in a lot of car accidents, and they might take a few more than that, but the bulk, 80% of people are within that 6 to 10 range. There's only so many impact injuries and so many parts that will have this injury. And when we reduce it, we actually bring this tense situation back to normal. It takes a lot of energy for this to happen.
Sure.
Okay?
Sure.
But it takes very little to bring it back to the normal, flexible state, because that's where it wants to go. It just needs a little help.
Okay. And I'm sure you're not first on the list. You probably have seen them go through the usual Western medicine techniques, and then they come in after they probably haven't gotten the results that they want.
Oh, sure. Yeah, almost always.
Yeah.
We see people, that, again, that have been frustrated with the results that they've had. And somebody usually refers them in and says, well, you know, I was frustrated too, and I get this kind of a result. You might want to try it. It's only 6 to 10 visits, and so that's mostly who I see.
Yeah, and what a great thing to, you know, give them back their quality of life.
That's the joy for me, and to do it in that short amount of time. And people with chronic frustrating conditions, musculoskeletal conditions in particular, are usually spending a lot of time going to doctor's appointments, taking care of their body, and to be able to get to the end of that and leave them at a higher plateau, minimally, at a higher plateau of how they live and move. And I'm an example of that. I live at a higher plateau physically than I did as a younger man. I can do more, you know, because of this work. It's really a joy. Yeah.
So you've already experienced it on yourself then?
Oh, yeah. Traveling up to Toronto, as we learn, we treat each other. And so when I travel there, I get treatment, and it was very helpful to me. So I can do more now as a 50-year-old with my body than I could as a 40-year-old because of this work.
Okay. Wow, that's amazing, because they always say how much we deteriorate as we get older. And here,
well, generally that's the pattern, but not for the people that go through Matrix-Repatterning-Therapy, and it hasn't been the case for me.
Yeah, that in itself is a story, is a great story, and a great testimony too.
Yeah, thanks.
Yeah. Well, so what actually qualifies then in regards to an impact injury? You had mentioned about falling down,
right,
you know, a car accident, things like that. So is there any specific, you know, that you have to have in order to come to you then for the injury?
Yeah, you know, again, by screening people over the phone, I want to hear that they have some memory of these impact injuries. And an impact injury is just something where you were hit hard enough. Now, we don't categorize them ourselves as impact injuries, so I usually have to push and prod and pull that out of people, because, you know, when I was 17 or 15, you know, and I was a crazy athlete and climbing trees and falling out of them, I would bounce off the ground and run on, and I thought I was fine. Well, my practice now is taking care of people that thought they were fine, but then they're 40 and 50 and 60, and their quality of life is going down, their activity level is going down, and those injuries are there, and that's who I treat. So I screen that first, but what qualifies as an impact injury is really any time you hit the ground hard enough for this cellular tension to take place. Okay? I say hit the ground because that's the easiest one, but sometimes you might be hit, you know, someone had an attic door fall on their head when they were 2 years old. And as a 40-year-old, had headaches, for instance. So there can be all kinds of things like that, you know, being falling on the frozen ground. Hockey players being slammed into the boards hard enough. Football players being hit on the ground. All really, there's no, when you start working with people, there's no end to the way they can injure themselves. It's quite interesting.
Yeah, and we're taught just to get up and, you know, be tough and keep going.
Be tough and go. And when your body's young and more resilient, you can. But eventually, you see, these injuries will accumulate over time. So a younger person, just because of time, will have had less of them. And their body is more resilient and flexible. But over time, even though I'm not a crazy football player or falling out of trees anymore, I still slip on the ice or get in a fender bender or a car accident. And so they accumulate over time, and our bodies generally become more flexible. So usually I'll see people when they get to that point where they're feeling those results, you know, in their 40s and 50s. I see younger people. I've treated children and teenagers, but a lot of it is that, you know, as we get stiffer, these injuries manifest or they will show up more.
Yeah. Well, that's good to know. And, you know, I really would like to have you demonstrate, you know, a little bit more about how the cell structure changed in relationship to the impact injuries, and how do they become, you know, real tense. So you can go into a little more detail on that. That'd be great.
Okay. I'll try to do that. I think one of the thoughts that I didn't express yet, because it comes up as a question with my patients all the time, is why don't these cells just go back, right? If they blow out into this rigid tension state, why do they stay there? If it happened when I was 2 or 15 and now I'm 50, why is it still there? Shouldn't it just go back over time? And the reason, now, if you could just fall on one cell, okay, which it would be pretty tough to do, and there was enough energy and it blew out into a rigid tension state, everything in its structure wants to bring it back here, okay? It just wants to go back. But remember when we talked about how the body developed and how it unfolded and how completely interconnected the skin cell is with the nerve cell and the heart cell and the bone cell. It's just this one big web, okay? So what really happens as, say, you fall on your knee, is a whole region of these cells will blow out into this rigid tension state, and now you have a template holding each other in this state. It took a lot of energy to get there. A little tiny fall wouldn't do it, but if you fall hard enough, it will. And so you have them holding each other like this. So it took a lot of energy for this to happen, and what we do then is just compress it. The treatment is just gentle compression. And as we gently compress, this tension begins to release,